Jason McIntyre is at Kelowna General Hospital recovering from complications of diabetes. Diagnosed at 24 and now 41, he has experienced more than his share of health challenges from this disease.
I've been so sick lately, I've been throwing up. I just found out what it was. I didn't know what it was for the longest time, so I was suffering with that.
The disease has also affected his eyesight and circulation.
Now I have diabetic neuropathy. That's one of the progressive things. I have no feeling. The nerves are all damaged. No feeling in my feet up to about my knees. And other than just a numb, kind of club-footed, I trip when I'm walking on flat surfaces.
When I saw you, you were having those low blood sugars.
And
it sounds like that stopped, because we talked about that was the most important thing.
Now Interior Health has a new approach specifically suited to diabetes. Heather Busby has been hired as the hospital's new acute diabetes nurse educator as part of a 3-year strategy to support patients such as McIntyre.
My role is to see in patients that have diabetes who are complex, so people that are struggling, not just that they have diabetes. And then I work with the staff, I work with the patients, just try to optimize their care. So I'm giving medication suggestions, providing education support for the staff and the patient.
you know, it's just really scary. I'm glad that they're helping me to treat it. I wouldn't have known this on my own, right? I wouldn't have known what was going on, so I'm really grateful for the renal clinic. They've helped me a lot.
Often patients come in for surgery or for another reason and still have to deal with the underlying effects of diabetes. They tend to heal slower than patients without and often require close monitoring to ensure their insulin and blood sugar levels remain stable enough to allow for healing.
Diabetes, it affects every kind of area of the hospital, so people are coming in with other reasons, but they have diabetes. And so to be able to have someone in the hospital, to be able to come to them, give them support, physicians have been really receptive. They've really appreciated having someone to refer to, just to give them some suggestions. And so just in general, it's been well received by patients and staff.
Diabetes is growing at an alarming rate in Canada. Physical inactivity and obesity are some of the causes of type 2 diabetes, with the role of diet playing a major factor in that.
I think that kind of what we're realizing is we're eating way too many processed carbs, and so the carbohydrates that we're all eating that we're seeing as natural part of our diet is actually way too high for a healthy diet, and that is definitely part of it.
And do you still have those kits that I made up for you with the honey?
Diabetes can be very intimidating as there is a huge variability in how it presents in each patient. Getting the education and support they need is critical for patients who end up in KGH.
And I don't know what's going to happen in the future. I don't know if I'm even going to live for the next 5 years. I don't know, right? And it's scary.